questions affecting families and parents of children with developmental disabilities. And it's a listening session, so I didn't want to come at you with a row of experts to talk about legislative stuff today. We want to hear from people about what's going on with them. We'll mention some of the legislative efforts that are underway as we go through it, but I really wanted to hear from people. So we've assembled some great experts here whose expertise and integrity is, I should say, unimpeachable. How about that? And who are very devoted to the cause. And we've got lots of parents here. And so we're going to hear from all of them. Before we do that, I want to introduce some people that I've brought with me. To begin with, my Chief of Staff from Washington is here, who is Julie Tagan, and my District Office Director right next to her is Kathleen Connor. Right to my left is the organizer of this event from my Rockville office, Jenny Mooch, who is one of my constituency service aides. Nina Weisbrot is here, I don't know, over there. Please stand as invited. Erin Fuentes is here. Also from my District Office, Victor Burton is there in the back, and Samantha Brown, who is my communications director, who is also acting as our Facebook Live camerawoman today. And we have a bunch of interns that we'll get to introduce you to as well. Joseph Eong is here, my constituency service representative. Hello, Joseph. And we're joined also by two people from our friend Senator Chris Van Hollen's staff, State Director Joe Kleinman. Is Joe here? There's Joe. Thank you for coming, Joe. And Patrick McCarthy is there as well. And so we're delighted to be joined by both of them. So without further ado, what we're going to do, now we know in Congress, most of our speeches are limited to 1 minute. Maybe they're not limited to 1 minute, but we have a timer for 3 minutes here, 2.5 minutes. So think it forces a certain kind of discipline on you. I couldn't believe when I first got to the House, because in the Maryland State Senate, it's a Senate, so it's filibuster rules. You go as long as you want. But I actually like the House rules because people listen much more carefully, because people speak much more carefully. You really distill your points to the 2 or 3 things that you really want people to understand and say. It won't be the last time you speak. We'll have more discussion, but we've got a lot of people here who want to get in it. So Ava, who is one of our star interns, is going to be the timekeeper. So when we get started, she's going to turn it over, and then the stand is going to be marching to the bottom. So in 2.5 minutes, she will give you the red card signal, and if you go too far beyond that, it's like offsides and soccer. We'll get timeout. So, is there anything else? All right, with no further ado then, we're going to begin with Jalen. We're going to start with Joshua Lash. Joshua is one of our interns in our district office this summer, and he is going to be the intern who gets to speak here. He's got some interesting stuff to say.
Thank you, Congressman Raskin, for the kind introduction. I am Joshua Lash.
Thank you, Congressman Raskin, for the kind introduction. I am Joshua Lash, an intern in Congressman Raskin's district office, and it's an honor to be with you all here today. Throughout my K-12 experience, I was in special ed classes in Montgomery County. In middle school, I struggled to stay in class. Because of this, I was placed in law school for my second time. Publicly funded, so thank you all for your tax dollars. Through this individualized support, I was able to grow academically and socially. Through the sports program here, I was able to learn perseverance. I was able to grow perseverance and leadership skills. I have applied these skills that I have learned before school. In college, where I've had leadership positions, I volunteered for many different organizations, and now I have the honor of interning Congressman Raskin's district office. Thank you.
Joshua, thank you so much. We're so proud to have you and all of our wonderful interns with us this summer, including Zoe Kaufman, Ava Durant, whom you've met, Nick Porter, and Amy Rivera. So I'm delighted to have all of them working with us. And we're going to pass the microphone around, beginning with Jalen Prince from Madison House Autism Foundation.
Thank you. I'm a parent of a son who is 29 years of age who is on the autism spectrum. We started a foundation here in Montgomery County 11 years ago, and we're working on the issues facing adults with autism and intellectual disabilities. And I come at this both as a parent and now as an autism professional, and seeing what the lay of the land has been. And one of the things that I'm deeply concerned about is that we are making a wonderful investment in our individuals with disabilities in the school systems, but we don't really have an effective way of engaging individuals after they graduate. And there's been a tremendous investment nationally in our loved ones, but if we don't nurture and we don't continue with education programs, keeping people engaged, they're going to regress. And a lot of the money that has been spent will, in a way, backward. And if we can work wisely, I think we can look toward ways of saving the nation money, saving heartache for parents, because I can look at spaces here and I serve as somebody who will get 2 o'clock in the morning, wondering what's going to be happening with their old child. We need to address these issues and to have more mechanisms that after graduation, not just a transition program, because that usually is something that applies a couple of years and then everything is fine. But we can look at age 21, at the age of 80, 90, or children that do not have answers, and there's not a whole lot happening on the national arena to address these things. There's certain policies actually that are making it much more difficult, including some of the funding and things that are coming to families. So I think that would be my observation, both as a professional in the area and as a mother who's been away to Turkey and wondered what would be happening with my son when I'm no longer around.
Jalen, thank you very much, and thank you for the tremendous work you're doing in Madison. It's very much appreciate the focus on adult children with disabilities.
Hi, my name is Bonnie Baugh, and I have a daughter, Asher, who's 35, and she is at Community Support Services. And as a family, she's our only child, so we devote hours to staying awake at night thinking about one thing. But we are aware that there are changes in the air that we don't understand. And as a parent and a taxpayer, it seems fairly simple to me that we have systems in place now. Don't fix it if it ain't broke. And they're being broken by people who really don't wake up at 2 o'clock in the morning with worries about disabilities. And if there's any way that we can help as a group or help individually, I don't know how to educate people on such a broad scale about disability until it hits their family. And that can be in old age, young age, infancy. If there were a school of education for Be Aware, I would like to be part of the administration of that. But in the meantime, I ask you and your staff to be available to us at CSS and everyone here that's represented, just to hear us, because we know what we're talking about. We live it. And I think we're your best resource. Thank you so much.
Bonnie, thank you very much. And I should say my staff is here to listen to everybody, but then also meet with people afterwards, and people have individual issues that we can help with. I don't know if you've got the best congressman in America, but you've definitely the best congressional staff in America. And these people, they live and breathe and eat the needs of the people of our district. So we will go after it. And for anybody out there watching us on Facebook, you can just call our office or email us, and we will get back right in touch with you. Thank you so much, Bonnie. Susan.
And my services, residential, and all kinds of different models of that. And people have choices about where to obtain their services. And I hope that we can encourage the current state administration that funds these services to listen to this resource. As Bonnie said, they are the best resource, and we do know how to design these services and to run them.
Thank you very much, Susan. Totally appreciate your leadership. And I can tell you the number of people who have said to me, Montgomery County's leading expert and one of Maryland's leading experts on services for children with developmental disabilities is you. So I appreciate so much everything that you've done, and I had the honor of getting to visit the restaurant that you put together where people are working, and it's really I took note of Barbara Brown. Before I introduce you, Barbara, I just want to reference the conversation we had earlier with Ken Chat. She said something very interesting to me, which is that this is a useful endeavor today because we're getting to educate a much broader audience about the issues that are confronted by families. And correct me if I'm wrong, Barbara, but she said something like, it's sort of like what the LGBT community has been able to do, where you took an issue which was really in the shadows and you brought it out into the open. And I remember so clearly, I always tell the story about when I first ran for the state senate in 2006, and people said we don't support marriage equality because it'll never happen, it'll never get there, and it makes you sound like you're really extreme. And today, it's just taken for granted by most everybody. It's part of the law and it's part of the culture, and we need to have a law and a culture that completely embracing of the diverse families we got and different kinds of issues. So thank you for giving me that perspective.
I'm here wearing two hats. My son is an individual with developmental disabilities, and he lives in a group home that is run by the Jewish Foundation for Group Homes, and I'm the president of the board. And we serve, it's a 35-year-old institution that grew out of the deinstitutionalization and creativity of parents, and we have a variety of residential options, those who are as well as private pay. We have homes, we have apartments, we have condos, and we're always thinking about more community inclusion. Okay. And we also have a program called Meaningful Opportunities for Successful Transition. Because of this cliff that other people have talked about, that our children fall off when they get out of the school system, which is fantastic here. And we've been able to give people help with transportation and social skills and work skills. 95% of our 180 graduates are now employed or doing some kind of skill or craft that they want. We need more and more of that for our lifetimes. The biggest issues I see for our residents, particularly when we focus on health, is that happily they are living longer. And as they get older, they have more and more health needs. And the Affordable Care Act has been critical. Please help us hold on to it. It's eliminating lifetime caps on benefits, making sure that 85% of the premium cost goes to care, and paying for habilitative and rehabilitative therapies, which so many of our residents need. So health and how to help our residents as they age and have physical challenges as well as other challenges is one of our big priorities. And of course, for everybody in employment. I don't know if you saw an article in the paper today, it's with me. The president is moving the economic research services arm of the Department of Agriculture. The president is moving the economic research services arm of the Department of Agriculture to Kansas. And my son is a contractor and has been there working in the mailroom with his colleagues with disabilities for 20 years. And come September 30th, they're all going to be out of work, according to this article in the paper today. So I think there's a focus on making sure that employment continues. It's so important, it's so fulfilling, it's so central to the identity of the JFGH residents and for me personally. So, thank you for listening.
Barbara, thank you very much for that excellent contribution. Everybody, please remember for Facebook Live to keep the microphone as close as possible. I know it's a little unnatural, but we'll do now. Thank you. And again, asking everybody to introduce themselves.
Hello, I'm Nancy Poole, parent of a 26-year-old woman with disabilities.
Last time it was really overwhelming for her, but it was a good thing. I want to take it just in a slightly different direction, and I am piggybacking off of what all the women before me said. It has to do with services, because Annie is so designed. Just finding programs, activities, the job seems way far away yet. But what this level of person needs is therapeutic services. And therapeutic services have been taken off the table in this latest DDA revision. And it is so important for this level of disability to have access to this sort of thing. The focus is all towards employment, which it should be, and it's good. But for those who can't even get there yet, we need lifelong learning, and that's what therapeutic services are about. And so I need your help in convincing DDA to rework this, because we're knocking our heads against the wall here. So the second thing, I still have a couple minutes, is that my husband and I are both designers, and we were very involved in That's a Wrap. And we offered quite a bit of services towards making that all happen. And I am so frustrated that could fall apart right now. You need to get involved in that too, because we've been fighting this and bringing some pretty incredible understanding to it, but we're at the standstill, so we need some help. We need to look at that.
I very much look forward to working with you on that. Thank you so much.
My name is Bob Astro, and I'm the father of Scott, who's 28 years old, serving CSS, living in the homes, and works a variety of jobs. Top issue for me right now is we need to recognize that every one of our children, their needs are slightly different, and their capabilities. The services need to be individualized, just like we used to talk about when they were in school, individualized education. Well, as adults, they need that too. For me right now, the focus is jobs. My son works several different jobs, one of which works in citizenships, servicing vending machines. Great job. They put them in, my former employer, uses it's done through CSS, and young adults come out there and service the vending machines. It's great. Everyone in the office loves it. I've taken the young adults around the office, introduced them to people, and people are glad to help by using that service as opposed to a traditional vending machine. Very creative way to create jobs. The restaurant, same thing, creative way to create jobs. But those jobs aren't necessarily going to be able to be appropriate for everybody. We need more jobs, and we need to be creative about the way we structure jobs. There's nothing more important and fulfilling than doing work every day. My son loves it, and I'm sure everyone else that's here as children love it or will when they finish school and get the opportunity to work. So that's the top issue I'm most concerned about. And from the government, both state and federal perspective, we need to be sure we're not creating roadblocks to create the kinds of creative jobs which sometimes need peeling apart what we traditionally think of as a job into smaller jobs that can be shared amongst individuals with different capabilities. Heather was here, represented Montgomery County at the state. My son Scott used to do data entry. Now Scott does not have the greatest attention span on earth, but he can type, and he can type accurately. And so she created a job in her office where he was typing the names that she would collect at events like this. And he did that 1 day a week. Great job. And it took a little creativity to structure that job. That's just one example of what we need to be doing. Thank you.
Thank you so much. And Heather and Missy and I served together in the legislature in District 20, so I will definitely pass along this nice work. I'm glad that he had that opportunity.
You need some data entry. Let's start.
All right.
Hi, I'm Susan Marta. I'm wearing several hats today. I'm a special education teacher in Montgomery County for 20 years. I am a commissioner on the Commission for People with Disabilities for 9 years. I chaired
Susan, you just lift your microphone.
the Developmental Disability Advisory Committee, and I'm on the state DDA and QA committee. But my most important job is I'm a mom to Emily and Lauren, who are 34 and 29, and severe developmental disability. My first background was in therapy and recreation. In the 70s and 80s, I did some internships at the Great Oak Center. And while this was not a place that was full of filth and pestilence, it was a place where people were warehoused and cared for by staff who were not properly trained. We made a commitment to those people when we moved them back to the community that money would follow the people. I think over the years it's pretty fair to say that money has been chipped away. My kids today have better lives than I ever dreamed of. The prognosis that I was given by the experts 34 and 29 years ago was not good. But today they work, they play in the community, they live in side-by-side townhouses with staff support, they take care of all the needs in the house. I go out in the community with them and people are always stopping to say, oh, to them, not to me, because they are known. I am very aware that the changes that DDA is providing or suggesting in their transformation will chip away the support services that they have received and allow them to evolve that far. We have been loud and strong and consistent in our advocacy, and we are not being heard the way we need to be heard. My kids go to CSS instead of being a model for programs, but they're suggesting or for reasons completely revising how they do business. And that is wrong. It's just wrong on every way sense of the word. Thank you.
Thank you very much. By the way, for people out there who don't know, CSS stands for Community Support Services, and that's what Susan runs. This is
I am Larry Graham, and you know me from Easter Fields where I work, but today I'm going to have a couple hats. So I'll speak as a parent of a 25-year-old daughter. And, thinking about what on a federal level really impacts our life. And it's the fact that all services come through Medicaid. And I don't think the general public knows that, but when we talk DEA, we're talking Medicaid. And that sets up so many barriers. My daughter, when we were born, when she was born without a piece of her brain, we were told she'd never speak. Now, she has a college degree in speech and hearing and wants to become a speech language pathologist. That's great, but if she got a job at Martin Gray for speech language pathology, she would lose her Medicaid and she couldn't work and she couldn't get out of bed because she's physically very disabled. So that linkage, there should be health care separate from services. That people with permanent disabilities should be guaranteed health care, and then the other services should come somewhere else. And they shouldn't be linked. Employment shouldn't be, services shouldn't be linked to assets. My daughter can't work without services, but if she works too much, she'll lose her jobs. So that's one thing. The second, now thinking more Easter Fields, is we're working on a project here in the county to get every child appropriately screened by pediatricians. That doesn't happen now. Maryland is pretty good at about 40%. Other states, Virginia's at 25%. We know earlier is better, but one of the worries we have is that if we succeed on this, the infant toddler programs, IDEA, are going to be slammed, and we need to fully fund the IDA. We know the investment in early intervention, and the earlier you do it works. Again, when you were at our center a few weeks ago, you saw 2 kids playing, you asked if anyone had disability. Those 2 kids, those 2 boys were 2 kids with disabilities, one with autism, one with speech issues, becoming friends. You know, you couldn't even tell because of the level of service that was happening. And that's really important, to get those kids together, included early. Thank you.
Thank you so much for that. And I had never heard the point, let's put it that way, that there are people in a situation with your daughter, they can't work without the services they get, but then if they work and learn too much, they lose the services, and that's a terrible catch-22. And I'm going to look into that. I don't know if there have been legislative efforts to ameliorate that.
The ABLE account is a great step. It's a fantastic law. Raising the limits would help, but really, you can't have $2,000 in a bank account at any time. But what if your paycheck gets close to that? It's really complicated.
Well, I appreciate that. Thank you much.
I'm Shanita Stone, and I'm the mother of a medically complex young man with developmental disabilities and physical disabilities named Robert Stone. He just transitioned from MCPS in January, and I'm also a member of Little Lobbyists, a group that advocates for the needs of medically complex children and young adults. We're using the term medically complex now instead of medically fragile, because medically fragile makes our children sound incompetent, and they are not. So my concerns echo many of those shared around the table thus far, that our children are integrated in the school system, and yet when they leave the school system, they're sort of dumped into different buckets, sometimes according to old-fashioned metrics of high functioning versus low functioning, which I think everyone should scrub from their heads. And I'd like to say that medically complex, I made a mistake, medically complex children, when they leave the school system, are becoming extremely segregated and isolated from their peers. And they in fact have very few choices in terms of programs. I mean, we have a robust suite of programs in Montgomery County and the state, but medically fragile children cannot access them. And this is because Medicaid creates a series of stovepipe systems that prevent Medicaid programs from interacting and supporting children like my son. As many of your staff know, and Senator Cohen's staff know, the Division of Nursing Services in Maryland has flat out refused to cooperate with any of the other service providers. And they allocate their services based on the parents' need to work and sleep, even after children turn 21. And as your staff know, I am concerned that that violates the civil rights of adults with disabilities, because they're not receiving nursing services based on their own needs. Whereas the DVA, for example, provides services based on the client's need. So it's a complex story, and I'll leave it there. But please, everyone around the table, just understand, this is a small cohort of people, and my concerns as I've gotten involved in advocacy efforts over the last 5 or 6 months, really, are that the needs of medically complex children are not being taken into account by the county, by the state, by the federal government. And if I were unable to care for my son today, his only option for receiving 24-hour care, nursing care, would be in an intermediate care facility, which is de facto a nursing home and an institution. And the one that is closest to our house, is actually not fully wheelchair accessible, ironically. So, please, continue to consider, and I will continue to advocate for the needs of medically complex children in our system. I think my time is.
Thank you for the very important statement. I really appreciate it.
Hi, my name is Laura Gordon. I have a few hats as well. I think we all do. First of all, I am the mother of an autistic son. He's 11 years old. I am also the president of the board of X Minds, which is Partnership for Extraordinary Minds, and we are a community resource here in Montgomery County. We focus on improving the educational outcomes of students on the autism spectrum. And I also am a substitute teacher in special education classrooms and a substitute paraeducator in classrooms. And the reason I started to do that is because I wanted to learn more about what was happening in the schools. I don't know how much of you know that Montgomery County and many districts across the state are switching to what they're calling a homeschool model, which I like to refer to as a neighborhood school model, where they're saying, we're gonna try to educate all your children in their neighborhood school if at all possible. I love this idea, it's a great idea, but they've started implementing it without giving anybody resources to implement it. So my concern is that I just attended an MCPS special education budget meeting. What was good to hear is that we're all on the same page when it comes to what is needed regarding this homeschool model. We need more professional learning. We need for both teachers, staff, and paraeducators. And that includes staff at schools, not just teachers, but janitorial, administration, secretarial. Everybody needs training if you're going to be truly inclusive and do this new homeschool model. What really struck me, though, as we were talking about the budget, is they are basing, so the state is a huge part of the MCPS budget. But in order to receive funding from the state, MCPS has to meet certain requirements regarding the achievement of students with disabilities. Now, the way that they're measuring it is by a standardized test, which to me is an oxymoron. You're giving a standardized test to children with very diverse needs and levels, and yet that test is what determines what resources those children are going to get to learn. It makes absolutely no sense whatsoever. So anyway, that's sort of where I'm at in terms of just trying to change that whole system.
Thank you very much, Laura. Totally appreciate that.
Hi, my name is Maria Hott, and I also have a couple of hats here. My daughter, who's 7, was diagnosed with severe autism spectrum disorder, and I am a member of the board of Partnership for Extraordinary Minds. Laura.
I'm sorry, say that again. Member of the board of
Excellence, Partnership for Extraordinary Minds. I just really want to tell a brief story to illustrate what it's like to be a parent of a child with severe disability. My daughter was diagnosed at the age of 3. We were living overseas at the time. My husband was stationed there as civilian with the U.S. Army. And my daughter's diagnosing physician said we had to, it was imperative that we return to the United States for her to get the therapy that she needed, which was 20 to 40 hours a week of applied behavioral analysis, or ABA therapy. 6 weeks later, we were on a plane back to Montgomery County, where we're from, and we thank our lucky stars because we couldn't afford the therapy because insurance didn't cover it at the time. And the Montgomery County Public School System offered a 30-plus hour a week program for children like my daughter that is based on the principles of ABA therapy. What we found was the program was unsuccessful and did not meet our child's needs in spades. She plummeted, regressed terribly, and we didn't know what to do. So eventually, there was a mandate for federal employees like my husband, mandating that we get coverage for ABA therapy. So we were very lucky, and after a lot of struggle and waiting lists and years of panic, we finally got a qualified therapist to work with our daughter. And the change was the closest thing to a miracle that I've ever witnessed in my life. The problem was this seasoned therapist that we were able to find was out of network she plummeted profoundly. So last week we finally began homeschooling my child because we feel we have no other alternative here. And it's really made our life very, very difficult. And we can't believe how lucky we are to be able to do what we're doing with her. We feel like we've been pinged back and forth between a healthcare system that, on the one hand, is telling us, providers are telling us, your daughter urgently needs this in order to have a modicum of a functional and independent life. And then on the other hand, is not able to provide us with quality, at any level, therapy or services. And then on the other hand, a school system, which in our experience, I'm not saying everyone else's experiences, but in our experience, is making promises it can't keep. So after a lot of searching, we think we have finally found a happy medium for our child. And as a mother, as a member of a community that I hold dear, and as a member of the board for Partnership for Extraordinary Minds, I'm personally taking it upon myself to research some of the educational programs in other states that are seem to be having slightly more successful outcomes with children with severe autism, and see they have successful training programs for the educators that seem to be budget conscious and successful and outcome based. I'd like to look into that and see what I can bring back to our state and speak to whomever will listen about what we can do to improve the educational outcome for children like my daughter, because the outcomes could improve drastically. And I hear all these stories and they sound scary to me. And I just want to be able to do something, and I'd love our state to be able to do something to improve this from the bottom up.
Maria, thank you so much for the research you're doing for everybody, and also for telling us this powerful story about what's going on in your family.
Thank you.
It's Maggie. My son Kyle is 27 years old, and he's at Community Support Services. Talking into a microphone, I've never done it before. At any rate, Montgomery County has been fantastic for services for kids with autism like my son. I just wish the state, in the new DDA rules as they're being rolled out, would be sort of take a page from Montgomery County in that respect, because what's been happening has been confusing to parents, to providers, and since my son Kyle has pretty severe aggression, he's on a reduced schedule that requires him to be, he can't be employed at this time, so I'm afraid that the new rules that are being rolled out are going to prevent the provider from being reimbursed for some of these hours that he cannot be out in the community. Thank you.
Maggie, thank you so much. I very much appreciate it.
Hi, my name is Joanne. I want to thank Susan for inviting me. I got a chance to lay on my ass with my expression for 10 days.
No, closer than that.
And, I was sick for like 10 days. Special needs parents with doubts, they don't get a chance to get sick. I'm a parent of a 35-year-old. He attends community support services. He's been at community support services since he was like 14. I have a younger son who's 28. He point blankly told me he's not going to do what I do for my son. So while I'm here, the programs are good. Some of it I heard transition, I heard get older. It's the same old stuff, but everything changed when it comes to cost. Cost is very important. My special needs son doesn't understand cost. He doesn't understand transportation. He doesn't understand transition. I'm his voice. So if my voice is not heard, he's not heard. When he's picked up in the morning, he's required to be picked up on time. He has the same people in the van. It works fine. But when I get letters from DDA where there's a cut for this, I get a cut for that, and I said, oh my God, I have to go backwards. I have to learn all these lingos. I have to get educated. I don't want to be part of any group. I want to service my son. I want the county to service my son. I want the county to stop cutting costs. Where she doesn't understand cutting costs. Like like my son says, siblings of people with special needs. It's very important to keep the transition going. Every household would be happy if the government would decide one day, we're servicing your household, we're servicing your child, we're servicing the day program, we're gonna make the person who transitioned from an MCPS a smooth transition. I got a chance to talk to a parent, and she said she's gonna provide transportation to and from her home. I said, I wouldn't do that. One of my friends reminded me, and my co-workers reminded me, Joanne, you don't understand what you do for a sheep. It comes automatic. You don't think about what you're doing because he's your son. They don't understand that. So in order for you to be happy, your son to be happy, the government cannot continue to cut the cost. They cannot continue to do that. We have a parents full of people who started groups because costing measures. They're not considering our sons and daughters. Susan runs a day program. She called me. I accepted her challenge. I was sick. I said, I'm going to get out. I'm going to make this work because it's very important to everybody at this table. I'm sorry for the lady with the red card. I will discontinue. Thank you very much.
Thank you so much for coming and for your thoughtful comments. Totally appreciate it.
Hi, my name is Tira Packett. My son is Kenny Packett, and I am very lucky to have him in Easter Seal Day Program and Jewish Foundation for Group Homes. One of the things I'd like to do is thank you for your work at supporting minimum wage, because the staff people in the group homes have amazing, incredible expectations, but many of them are only making $10 or $12 an hour. It's just incredible what they have to do, and consequently, the staff, there's constant turnover. So continuity of care is a real issue. You know, you're talking about them getting used to a certain routine, a certain person. They're learning that over and over. And along those lines, one of the things that happens, should our son or daughter become critically ill and have to go to the hospital, funding to the group home stops. It supposedly goes to the hospital. The group home is not supposed to be interacting with your sick son or daughter. Well, that's crazy, because the hospital, rotating doctors, rotating nurses, they have no idea what's going on with a special needs person. It's something we really need to look at, because there is no continuity of care. Unless you're there like a hawk, there are going to be problems. So thank you for listening.
Thank you very much for your comments, and we are absolutely fighting for an increase in the minimum wage, which has been eroded now over the decades, and it's great that you make that link to the quality of care that people get in the caring professions. So thank you.
Hi, my name is Margie Billion, and my son's name is James Billion. I hold two hats myself. I'm with the Jubilee Foundation Board. I'm a special needs mom. I totally understand you two ladies. I was audited in 2009 by the IRS. And at the same time that I was audited by the IRS because of my son's medical bills, my son got Social Security, and 3 weeks later he got Social Security. And I had to pay a CPA $3,000 to prove to the IRS that my son had over $70,000 in medical bills. And I had a stack of papers this high. We were able to prove to the IRS. At the same time, my son had no DDA supports. My son, I would have been a parent in extraordinary minds. My son is very quirky. He's an artist. He's a poet. He's a filmmaker. He has many films that are on YouTube. And it took me, I had to get a lawyer, 2 psychologists, and a social worker to help me navigate the system to get him DDA. He is a 5 out of 5 on the DDA scale. He can't wipe himself. He has trouble tying his shoes. He actually was in Madison House. Thank you. He was in Madison House with the art program. Thank you. Thank you. Thank you. But he's doing very well now. But it was cool, and it was like pushing an elephant up a hill. It's
still grueling. At the same time, the past couple of years, he's been abused 2 times in 2 different group homes. I mean, the people are amazing, but 1 or 2 people have abused him because he's working. And, you know, people are being paid very low wages. As a special needs parent, you just don't have the bandwidth or the energy. And it's grueling. It's really sad. Thank you so much.
Thank you very much. I very much appreciate your telling us a lot of important stuff there.
Hi, I'm Heidi Kreiser-Daroff. Thank you for doing this. Thank you, Jenny, for inviting me to be here. I also wear multiple hats. I'm a board member of Respectability, which is an organization that serves to fight stigmas and increase job opportunities. And I'm also the mom of a daughter on this autism spectrum. And she's 16 now, and I feel like I can identify with everybody who's spoken so far. The early years were an absolute nightmare. And then she began schooling at Ivy Mount, and that's been the complete opposite. It's been a dream come true, and it's been incredible. My concerns, though, are starting at 14, every IEP meeting that we've had, every planning meeting for the IEPs that we've had, are talking about this transition period. And we just had a meeting last week. It came up again, and they're very supportive. Ivy Mount's incredible. But you sit there, and as they're talking to you about this transition, I feel like we're driving up this steep hill, and I'm not sure on the other side. I have no idea. As much as they try to talk us through it and explain everything, it's like this big void. And I'm really concerned about job opportunities, or opportunities. I want to make sure that our daughter's not a shut-in when she's not at her place of employment that I'll hope that she'll have. So social opportunities, job opportunities, funding for all these programs, and like you mentioned, the safety. I'm terrified. She's a 16-year-old beautiful young woman, and every time she's not within my eyesight, I worry about who she's coming across. As much as we teach her, privacy and protecting herself, she's completely vulnerable to whoever comes in her path. So proper funding and making sure that they're well trained, that they know what they're doing, and that they understand if they need a break, these caregivers, that they can walk away and somebody else can take their place. I think safety is really, really important. Respectability says there's something like a 95% abuse number. I don't know if you've all heard that, but it's really, really extremely high, which is terrifying. So we want to make sure there's job opportunities, social opportunities, that everything's funded as much as it can be, and that they're included in the greater society, and they're not just shut-ins when they're not in some organized program. So, thank you.
Thank you so much, Heidi.
Hello, my name is Alex Rivas. I'm a client of Julie. I've been in Julie over 19 years. So I can relate for every parent here from here. I talk about the clients who have disability. And I thank you for the service that you do for us. And I thank you.
Thank you so much for coming. We really appreciate your participating.
Hi, I'm Ellen Jennings, and first, Jamie, I want to thank you. You're a supporter of Sunflower Bakery and Main Street, and my son did both the Sunflower Bakery training program in the bakery and in the cafe, and it was really an amazing experience for him. And we're members of Main Street, which is in the process of being built right here in Rockville, and will be an inclusive community center, which should be offering really amazing opportunities for adults with disabilities. So thank you also for your support of that. My son is 24. He has autism, a seizure disorder, and an autonomic disorder. He is currently receiving DDA services, and his agency is Outcomes, which is a little bit north of us in Gaithersburg. That's been a mostly good experience. He has managed to get employment at Harris Teeter on Old Georgetown Road, about 12 and a half hours a week, making sandwiches in the deli, because as you can see from the Sunflower Bakery background, his interest is push of job coaching that the DDA allows the agencies to offer. So since January, he started last September, since January I've been spending at least 4 hours a week with him. I work full-time job coaching at Harris Teeter from 7 to 9 a.m. in the morning when he's there. Now, is that working? Yes. Is that appropriate for a 24-year-old? No, it is not. Does it work for my schedule? No, it does not. A couple of other things I wanted to mention. I wanted to reiterate the point that I think Larry made about Medicaid funding, that most people do not understand that that is where our children with disabilities, adult children with disabilities, receive their funding. And that is a really key educational piece. When people talk about cutting Medicaid, not that anybody's Medicaid should be cut, but I don't think they typically understand that they're talking about cutting the major source of funding for people with disabilities. Two other things, while I'm thrilled that we now have an ABLE account in the state of Maryland, I was told when it was set up that it would be synonymous with a 529 account. I have 2 children with 529 accounts, and I can tell you that I do not have a $15,000 cap per year on those 529 accounts. I don't understand the $15,000 cap per year. I do understand the total cap of $200,000, but it seems to me we should be able to put however much we want in per year. And then just one other thing, and that is the pay for agency staff. It's not just a minimum wage issue. In my neighborhood, and I live in Tacoma Park, high schoolers, 15-year-olds, get paid $20 an hour to babysit. The people who are taking care of our complex kids with disabilities are getting about $15 an hour, and that's after the state of Maryland just voted on what they voted. So at the federal level, that has got to change if we want any sort of quality care. Thank you.
Thank you very much. I totally agree with you. Justin?
Good morning. My name is Justin Chappell. In addition to being an adult with a disability, I've also been a case manager for people with hundreds of people with disabilities here in Montgomery County. I would condense the issues that I have learned as the priorities for people with disabilities down to 4 that I'll briefly touch on, many of which have been discussed. Employment. We're so much talking about free college for all and things related to reducing the cost of college in these days, but we're not reflecting the fact that many people don't go to college and that many people have individual vocational educational needs, and they need to find a way to be able to afford to be able to pay for that. Secondly, we talked about healthcare, and as Larry mentioned, there is certainly a big disincentive for people that are aging out of schooling and entering the workforce that they can lose their healthcare. Now, Maryland is fortunate enough that former Governor Glenn Denning created a program called the Employed Individuals with Disabilities Program that does give some option to do Medicaid buy-in, but I know that there are many states that don't do that. And even when they do that, even though we do have the EID program, there are certainly still income and asset restrictions. And I've also known people that people with disabilities that had to turn down, $60,000 jobs because they still couldn't afford to pay for their attendant care, which can be very, very expensive. And we need to find a way to address that. The third issue, transportation. We need to make sure that we have dependable transportation, particularly here in Montgomery County. I know that just in the past week, I've had to wait 6 hours to get accessible transportation. I've had taxi drivers that have refused to pick me up because the rates that they get from the government to run their accessible taxi program is 50% of what they would get from a normal fare. And I also know that events that I've had in the evenings with people with disabilities, there is pretty much no accessible transportation that's available in the evenings. The fourth issue that, again, just briefly mentioned is accessible housing. And one of the things when I talk to people about the needs of people with disabilities that I mention to them is that disability is the only minority group that any person in this room can join at any point in their life. And yet, we always think that the needs of people with disabilities is the needs of serving a subset of our community. And when it comes to housing, for example, we build housing that is not accessible and then costs much, much more money to make it accessible, as opposed to finding ways to push universal design, which is something that I know that Congressman Jan Schakowsky has been working on for quite a long time.
Justin, thank you for that excellent inventory of employment and housing and transportation and healthcare as critical needs that we've got to figure out. We promised our friends here at Dawson's that we'd be out by noon. So let's view this as just another installment in the continuing conversation with the public and amongst ourselves. I will close with just a couple of thoughts, repeating some important themes I heard today. And I really stand in great awe and admiration of the people in this room. I think Maria and Laura both said that they wear many hats, and I think it's safe to say that everybody at this table wears a lot of hats, because in addition to the basic social roles that people occupy in life as like a mother, a wife, a father, a husband, a worker, and so on, you guys have to be full-time advocates for your children, and through a very complex maze of different programs and services at different levels of government and so on. And so I salute you all for it. I think Joanne said, if my voice isn't heard, my son's voice isn't heard. So I want you to know that I'm aware that if my voice isn't heard in Congress, your voice as my constituents is not being heard. And so that's why I'm such a loudmouth in Congress, okay? Because I want to be a very strong champion for Medicaid and Medicare and the Affordable Care Act and the IDEA. I'll just give you a very quick update before we break about what's going on in the appropriations bill, which we've been doing over the last several days. I was up to 2:30 in the morning, the night before the last one on the floor, making sure that we would get $1 billion increase for the IDEA, and so that's going to be $14 billion. We're hopeful that we're going to get through a $2 billion increase for NIH for a $41.1 billion. And I should tell you, Jaylyn knows this, but when I first got elected to Congress, the very first thing I was confronted with was President Trump's proposal to slash the NIH budget by $6 billion. And the very first speech I made when I got up on the floor of Congress was that I said, how is it that we can have an administration which is trying to attack the NIH, which, yes, admittedly, it's in my district in Bethesda, but this is a national and international treasure which is facilitating all of the remarkable pioneering research we've got going into the killer diseases like cystic fibrosis and multiple sclerosis and breast cancer and colon cancer and malignant narcissistic personality disorder, all of the illnesses that we need to confront as a society. Well, I will tell you, because we stuck together, a bipartisan majority reversed that proposed $6 billion cut, and we got a $2 billion increase. So whenever anybody is trying to dismantle funding for the programs we're talking about today, we go in and we say we need to increase it, we need to double down on the investment. $14.5 billion for special ed, which is an increase of $1.05 billion above the 2019 level. It's a special point of pride for us. We fought for the Special Olympics. You know, the Shrivers are a Maryland family from Montgomery County. The administration had proposed zeroing out the Special Olympics, and we've got $21 million in there for the Special Olympics to keep it going. And there are a number of other bills I'll just mention that I'm a co-sponsor of, which are of relevance to many of the things we talked about today. One is the Autism Cares Act of 2019. Another is the Disability Integration Act, which ensures that anybody who's found eligible for institutional placement is also given the option to receive services and supports at home or in the setting of their choosing. So that's HR 555. The Mental Health Services for Students Act, and the Transformation to Competitive Employment Act, which provides states, service providers, sub-minimum wage certificate holders, and other agencies with the resources that they need to create competitive, integrated employment service delivery models and inclusive wraparound services. So I think at least some members of Congress are beginning to get precisely the point that Jaylin has been making so eloquently, and many of you have been making today, about the importance of investing in that critical moment of transition out of school, out of K through 12, into the workforce, and finding opportunities to find the right individualized employment. So all these things are much on my mind, but my best resource is you, the people in this room, so please continue to be in constant touch with me, with Kathleen Connor from my district staff, with Julie Dagan from my DC staff, with Jenny Funt, who organized this today, and all the members of my staff to give us the best ideas. Montgomery County and Frederick County and Carroll County, which are all part of the 8th Congressional District, are very much in the forefront of establishing the best practices that we can come up with to deal with all the issues raised today. And so we want to make sure that the best ideas come forward immediately to Congress. And I thank you for continuing to educate me, and I thank you for coming out. And we want to thank our friends here at Dawson's one more time. The owner, Bart Yablonsky, is someplace here. Bart, he's probably making smoothies or something back there. But thank you so much, Dawson's, for having us. Let's give them a round of applause. And thank you, Facebook Live, for helping us